Hello and welcome to the Healthcare Huddle video podcast. I'm Rachel Slawson and I'm the host of the show. And today we'll be discussing the importance of investigating transmissions of COVID-19 within health and social care settings. We will be talking with Leslie Underwood, who is a registered nurse and public health professional. Leslie wrote the article entitled Investigating Transmission of COVID Within Health and Social Care Settings. You can find this article in full at the Fascia Melius website, which is fascia-melius.org.uk. We will also have the link to the article in the description and the show notes. We've recorded 5 episodes aimed at healthcare professionals within health and social care. Fascia Melius are sponsoring the series of podcasts. They are a healthcare consultancy firm which offers a unique combination of insight, innovation, and experience. They specialise in quality, governance, and patient safety investigations. So today we'll be giving you an overview of the article, and in the next few episodes, we'll be diving deeper into each area. Hello, Leslie, and how are you?
Hello, Rachel. I'm fine, thank you.
So, Leslie, for those who don't know, shall we discuss the background to this article?
Okay. I actually wrote the article on the back of my normal work, if you like. I undertake serious incident investigations, but I also, as you said, work in public health. And what I was feeling was that there's a lot of banter going on out in the general world about what's gone wrong and what's gone right and who's to blame for all of this. When actually what we should be doing is having a look back to see what actually happened, to see what went well, and to see what we could do better. So as part of this, I thought I'd use some of my skills to write some guidance for people just to assist them in doing a look back.
Yeah, really valuable insight there into the health and social care settings and what they're experiencing at the moment. So, Leslie, do you want to give an overview of the article?
Okay, it's a discussion piece, so people can take it or leave it, but actually it does highlight some of the things you could look at if you wanted to do either a full-blown investigation or a debrief session. So it gives you some areas to look at, some topics that might be worth an in-depth look. So certainly people have had issues with PPE, we know that.
Yeah.
So that's one of the subjects. But then when you look elsewhere, it's about how you transfer people safely from one setting to another. And just gives people a flavour of what they could look at if they wanted to do either a full-blown investigation or a debrief look back exercise.
Brilliant. What would you say to people who say they haven't identified any transfers of the virus? So they might ask whether they need to undertake a review.
Okay, no problem. And an absolutely brilliant pat on the back to them. That's exactly as it should be. But there will be times that they've encountered issues. There will be problems they've encountered on the way. And the idea of this is to enable them to look at how they handle things. As I said, what went well, what did they really manage well, but actually what were the difficulties? What did they have to step up to the plate for? What was it that caused them the problems? And if they can iron those out now, potentially we may have a second wave, potentially we may have a third wave, but also we've got flu season coming up, which means this virus is likely to kick off again anyway. So it's going to kick off. So if people actually are prepared for that, then they're in a much, much better place than having to start all over again to reinvent the wheel. And it may be that if they work through a review, a look back, even an SI investigation, they will have an action plan. They may then be able to write some form of protocol which they can pass on, because all of us getting older, we're not in our posts forever. You know, somebody else will take those reins, but actually better they have something to work to rather than reinvent the wheel.
Absolutely. I know that there'll be some people that will say, well, surely the government will review what went well and what the difficulties were. So do we need to?
Well, I think the government will. I haven't heard for definite yet, but I'm sure they will. But that's going to be some way off. That's not going to happen tomorrow. That's not even going to happen before the winter flu season. So best we do it ourselves. And actually, rather than be dictated to, it's actually better to lead it from the front yourself. You know what happened in your area rather than being told what people think happened in your area. So I would much rather people did it themselves.
That sounds like a good idea. And then you can really disseminate that learning as quickly as possible, really.
Exactly.
So how does this fit into the new serious incident policy, the 2019 NHS patient safety strategy?
Actually, it fits very well. A lot of people haven't managed to implement the new policy and are still working to the old patient safety frameworks, which is fine. They actually dovetail together, so that's not an issue. The new policy looks at improving understanding by people working together, which, when you look at this as a whole, it talks about equipping people with the skills they need, the opportunities, to provide that patient safety, but also to enable the people in the system to design the protocols and the systems that make it safer. Nobody knows better than the people who are doing it how to make it safer. They just need the skills to think about it and the opportunity to be able to do it. So the new framework is brilliant for actually enabling that to happen. But as I say, people haven't had a chance because COVID got in the way.
Yeah, that makes sense. You're not going to introduce something in the middle of a global pandemic.
No. You stick with what you know because it works.
Yeah, definitely. They've had enough change and new ways of doing things, and hospitals have been totally reconfigured during this time, so you don't want to throw that into the mix as well. And also lots of staff undertaking new roles in areas they're not familiar with. So
exactly.
So who would undertake these reviews?
It really could be anybody who has the skills to do so. Traditionally, transmission of infection is usually looked at by the infection control professionals. You may or may not have those within your organisation. If it's a social care setting, you may have somebody you can link to, or you will have somebody you can link to, but actually they may not be close in. There's governance teams can look at things. If it's a serious incident, there may be specialists trained in root cause analysis within the organisation. Other than that, if you really are stuck, then you can look outside, because there are other agencies that will undertake investigations.
What would the skills be if you were going to undertake the review, would you say?
If it was a full-blown SI, then you would need root cause analysis training, because it is a systematic systems-based approach. If it's a debrief, look-back review, then anybody can do it. Management skills, it's not anything very technical, very difficult, because it is those questions. Right, what did we do well? You sit your team down. What did we do well? What did we really do well? What do we pat ourselves on the back for? Get those out of the way first, and right, okay, what were the challenges? What did we really struggle with? Was it staffing? Was it agencies not providing people, or people turning up and then going home because they weren't going to work in a COVID area? What were those challenges? Okay, that's our challenges. How are we going to, if faced with those again, turn it round so they're not challenges? What are we going to do differently to stop that challenge happening? So it is a simple process, but when you've been doing it for as many years as I have, it's just second nature. You do it for everything, literally everything, which is a bit strange, really.
As the strategy hasn't been fully implemented, are people still working to the previous serious incident framework document?
Yeah, and that's still there in the background, which is absolutely fine. And you can use the principles of the new one with the old templates. That's absolutely fine as well. And actually, I think the underlying principles of the original strategy hold today as they did when they were brought in. We should be open, we should be transparent, we should be enabling people to hear the full story of what happened to them. Yeah. So if something went wrong, we should be there saying, we're really sorry. That's not to admit blame, that's to say we're really sorry something happened when you were in our care. So that's the duty of candour. That's what the government introduced. We have a contractual obligation as healthcare professionals to be open and honest and provide that duty of candour. But when you look at investigations, they should be looking at how do we prevent things happening again. So as I said, what were our challenges? What could we do differently to stop that happening again? It needs to be objective as well. It's not to beat people up. It never has been. It's about learning. It's about demonstrating that any investigation or look back exercise actually is objective. So it's about involving those people involved, asking them what happened, getting their stories. It's about being very robust. And the more people believe in you, that you will be open, that you will be honest, that you will be robust, that they will actually engage better. I also maintain it needs to be timely. As soon as you find out you've had an incident, you need to start investigating it. If you find 2 years down the line that actually we did something wrong, going back to somebody saying, we're really sorry something happened when you were in our care 2 years ago, doesn't hold well, it doesn't look good, doesn't sit well. So what you need to do is make sure as soon as you identify something that you do that bit of investigating and you do your duty of candor, you do say sorry. It should also be systems based. So there are, if it's a full-blown serious incident investigation, it should be based and run by somebody who has the root cause analysis training. So they are enabled to do that systematic approach, systematic look through to see what happened, what went well, what the problems were, what the contributory factors were, and actually what the root cause was of that issue. So there are many factors involved in that, and hopefully during our next discussions we can sort of pick out a few of those and work through them. But the other thing to say is any investigation needs to be proportionate. So going back to what we said, if somebody has died through this, then potentially it should be a serious incident review, full-blown RCA. But if nothing has happened, if we haven't spread anything anywhere, brilliant, but actually there's still issues that we perhaps need to look at. How many agencies were involved? There were hundreds of agencies involved, you know, from the army right through to social care. So actually saying, we can improve patient safety by including everybody who was involved. This is exactly what this is about.
What are the benefits of undertaking this review? I think you've covered quite a lot of them, but if you could just describe it a bit further for people.
Yeah, I suppose just to recap, all of us in healthcare, particularly those of us who have a qualification, be it nurse, doctor, social worker, whatever, have a duty to reflect on what we do. To maintain our registrations, we have to reflect and revalidate. So part and parcel of this is about looking at what we've done and how we've done it. So to me, the benefit is A, to ensure we're ready for next time, B, to do that look back and actually praise ourselves, because that's something we don't do very often. You know, particularly nurses, we're useless at patting ourselves on the back and saying how good we are. So I think that's very important. But I think some of that reflection will also help people to put things into perspective. It will help the mental health as well, because actually this has been a really traumatic time for a lot of people. So I think the benefits of doing it are actually huge.
So how in-depth does the investigation need to be to gain these benefits?
I think benefits can be gained from any level of investigation, whether it is a simple debrief, look back, or if you go to the full-blown serious incident investigation. If you looked at a debrief, if you actually recorded, wrote down some of the information that was given to you during that debrief and shared that with people, there's learning to be had. The same way, if you do a serious incident review, you get an action plan, that action plan can be shared. But one other thing to say is, we learn, but actually do we share that learning? And how far do we share that learning? You know, there's so much that people have learned during this pandemic, but I'm not sure how much of that is actually going to be shared. So I think the more we can share, the more we can learn. So again, it's really, really important to do this, no matter what depth you do it in.
Yeah, why reinvent the wheel if actually a neighbouring trust or somebody in a different county completely has come up with a really awesome way of tackling one of your biggest challenges? And I think that is definitely an issue the NHS has generally, that people do some really great work, but it's not always the ability to share that properly across the system is difficult, and some people do some awesome stuff, and you don't want to put a lot of energy into redoing it and learning those lessons again, particularly as with COVID, it all happened so quickly, so we didn't have a lot
Exactly,
of
it's brand
time.
new.
Yeah.
It's absolutely brand new. We've never done this before. We've never seen anything on this scale before. And we're thinking that, come winter, with winter flu and winter pressures, we're going to be under intense pressure again. So we're going to need to do something.
What would happen if a review found that there were failings?
Well, as I said before, we need to be open and transparent. We have a duty of candour, which means we need to tell people if we found things have gone wrong. The biggest thing is to say sorry. Now, that's not to admit blame, but that's just to say we're really, really sorry. Something has happened to you whilst you're in our care. And I think the quicker these things are looked at, the easier it is to say sorry. 2 years down the line, once the government's done their bit and had a look, actually it's too late to say sorry then. It doesn't mean anything. It means something now to say sorry. So in terms of if you found something, it would be, you would find it in relation to whoever you're working with. So if, for example, you're including the family in that investigation, they would be part and parcel of that. So they would help you identify when things didn't go right. So they would have an understanding, but actually just say, oh, we are really sorry, makes a huge, huge difference.
Yeah, definitely, particularly in like how people affected or the families can get over that grief or that shock or the incident. It can definitely support that and help them to go forward on their journey. Staff are really busy at the moment. Is there anything available that can help them if they do want to undertake a review?
Yeah, certainly. I mean, you can look at who does it. So you could have somebody from outside of your team support you. You could look at various tools that are available. There are the governance teams can help you, so certainly a different team within your organisation. But also, again, because of this reason, because I know how busy people are, I've actually done a checklist to try and help people through the process. It's based on the contributory factors from the SI framework. And it just enables people just to think. It just gives them headings to think about and various topics just to touch on. They can tick the box and say, no, that one was fine, but actually this one might have been an issue. Whether that was staffing, whether that was PPE, whatever it might have been, it just gives them those headlines to focus on. So it makes it easier and quicker to do any form of investigation.
Yes, and you'll be able to download that checklist at the fascia-melius.org.uk website. The links will be in the description below. But I just want to say thank you so much, Leslie, for that really informative discussion. I think it's, hopefully this will support healthcare staff that are in health and social care to feel a bit supported in undertaking an investigation. And we've actually got a whole series of podcasts around this. So we will be releasing them over the next Tuesday and Thursday for the next 2 weeks. And the 5th podcast will be a question and answer. So head over to Twitter or LinkedIn to submit any questions you have around governance in healthcare and COVID-19. You can follow Fascia Melius on LinkedIn and Twitter at Fascia Melius. And we, as I say, we've created that downloadable checklist, which will hopefully help some of you undertake your reviews. And if you're joining us via YouTube, please like and subscribe so that you can get future updates of our videos. And the next episode, I'm really excited, is focused on infection prevention control, PPE and infrastructure. Thank you so much for listening to this podcast. Please like and subscribe, and we'll stay safe, and we will see you next time.